FM Rainbow.
Akashvani FM Rainbow 107.1 megahertz. Musically yours.
22 minutes past 8 a.m. We're on to Hello Mumbai, listening to All India Radio's FM Rainbow channel on 107.1. And you're with RJs Kanchi and Bosco.
Yes, good morning dear listeners once again. और इस वक्त जैसा कि मैंने आप लोगों से कहा था, मेरे साथ होंगी बहुत ही खास मेहमान. जी हाँ, मेरे साथ हैं डॉक्टर अलका वालावालकर, who is the founder of Resonance L Nutrition. She is a recipient of Academic Excellence Award by hands of none other than Dr. APJ Abdul Kalam. Yes, good morning Dr. Alka. How are you feeling?
Yeah, good morning Kanchan and good morning
Bosco.
Good morning.
Very nice to be on your show.
Yes,
Hope you both are doing well.
Yes,
Absolutely
we are.
great.
And जैसा कि अलका है, क्लिनिकल डाइटिशियन है, न्यूट्रिशनिस्ट हैं, बहुत कुछ खास mantras और tips देती हैं. So Alka, my first question, I will just come to the point. Some tips that you want us to know to keep up the immunity and stay healthy and fit, especially in this period of lockdown.
So the very first thing is to eat healthy. Okay, because everything starts from our intestine, our gut. So we have to eat healthy. Now, what does eat healthy means? What are the nutrients which we have to take care during this time? The very first important nutrient is protein. Now, I'll tell you the reason. The first line of defense for our body is antibodies. Antibodies protect us whenever our body gets exposed to any infection. And these antibodies are made up of proteins. इसलिए इनफ प्रोटीन खाना बहुत जरूरी है, कम से कम 1 ग्राम पर केजी बॉडी वेट.
ओके अलका, मैं आपसे अगर पूछूं कि इस वक्त अगर लिमिटेड रैशनिंग है घरों में, तो स्पेशली क्या चीज़ें ऐसी होती हैं हैंडी जो कि आपको लगता है कि एंटीबॉडीज के लिए इम्पोर्टेंट होती हैं?
See, there are a lot of protein sources which are easily available. जैसे कि पनीर है, दूध है, दही है. अभी suppose in lockdown you are not able to access these things. The other important sources are the soaked legumes. Like अपने महाराष्ट्र में, even in North India, there are a lot of legumes. मटकी है, चौली है, मूंग है, and especially अगर इनको ferment किया जाए या sprout किया जाए, तो इनका nutritional quality बढ़ जाता है. So अगर हम और कुछ नहीं एक्सेस कर पा रहे, तो एटलीस्ट दिन में एक बार स्प्राउटेड legumes का कोई डिश बनाए, कुछ भी बनाए, you can cook it, you can have it as a salad, anything, but include sprouted legumes.
ओके. डॉक्टर अलका, आप एक मैराथनर भी हैं, नॉन मैराथनर है, तो जो मैराथन करते हैं लोग, स्पेशली उनके लिए ये एक बहुत ही लगता है कि लिमिटेड घर के अंदर ही, हाउ आर दे गोइंग टू बी रिमेनिंग फिट? उनके लिए कोई टिप्स अगर आप शेयर करना चाहें?
या श्योर. सी, मैराथनर्स के लिए घर में रहना और बाहर नहीं दौड़ पाना, इट्स अ बिग मेंटल चैलेंज rather than physical challenge.
Correct.
So I would recommend all the marathoners to pay attention to their core strength at this point of time, because running के लिए core strength लगती है. So since you cannot go out and run, concentrate on core strength. अपने core strength को develop करिए. और so when you are out on the road, you will be having a good core strength and you can run very nicely.
So I think बहुत अच्छा पॉइंट अलका ने कहा कि मेंटल स्ट्रेंथ भी बहुत जरूरी है, और इस वक्त जो है इससे अच्छा टाइम क्या हो सकता है? बॉस को आपसे एक सवाल करना चाहेंगे अलका.
Yes, what I wanted to ask you is, a lot of people have this perennial question, when to use a sanitizer and when to use a soap. If there are any certain situations for that.
Correct.
Yeah. See, this is a very good question. See, there are certain conditions where we should not be using sanitizers. We should be using only soap and water to clean our hands.
Okay.
And that is before cooking, before eating, before ingesting anything with our hands. Okay, so that time we are not going to use sanitizers to clean our hands. Secondly, अगर कोई भी विजिबल गंदगी है हाथ में, सपोज योर हैंड्स आर विजिबली सॉइल्ड, मिट्टी लगी है या कुछ भी गंदगी लगी है, दैट टाइम ऑल्सो सैनिटाइजर इज नो यूज.
Okay.
You have to use soap and water.
Lovely. I think Dr. Alka, you are making a lot of sense, लेकिन हम आपको इतनी जल्दी छोड़ने वाले नहीं है. We are going to break into a beautiful song. आप बने रहेगा हमारे साथ, कहीं जाएगा नहीं. थोड़ी देर में हमारे लिसनर्स के साथ आपकी और सारी जो इन्फॉर्मेशन है वो हम शेयर करेंगे. So be online, Dr. Alka.
Sure.
Akashvani FM Rainbow.
Akashvani FM Rainbow 107.1 megahertz. Musically yours.
Well, almost 8:30. Yes, of course, we're on to Hello Mumbai, listening to All India Radio's FM Rainbow channel on 107.1. And right now we're in conversation with Dr. Alka Wallavalkar.
Good morning, Dr. Alka, once again, and welcome back to our show, Hello Mumbai.
गुड मॉर्निंग।
यस डॉक्टर अलका, सो बहुत सारी बातें तो हमने आपसे जानने की कोशिश की। एक चीज़ जो एक अगेन वन इम्पॉर्टेंट क्वेश्चन दैट कम्स टू मी इज जनरल गाइडलाइंस विच शुड बी फॉलोड व्हाइल हैंडलिंग फूड स्पेशली, उसके बारे में बताइएगा प्लीज।
सी एट दिस टाइम्स in this lockdown and when this infection is so prevalent, we cannot afford to have a bad stomach or any type of gut infection. So handling food is very important. So few points which we need to take care is, first, never touch your food, whether it is cooked or uncooked, without washing your hands. मतलब कुछ भी खाने की चीज को हाथ लगाना है, वो फ्रूट हो, कुक्ड हो, अनकुक्ड हो, पहले साबुन और पानी से हाथ धोना है।
उस पर मुझे याद है कि एक लिसनर है डॉक्टर अलका, वो आपसे पूछना चाह रहे हैं कि मेडिकेटेड सोप ही ज़रूरी होता है क्या? फिरोज सिगनपोरिया लिसनर है हमारे, एंड ही हैज़ पोस्ड अ क्वेश्चन टू यू कि हाउ इंपॉर्टेंट इज यूजिंग अ मेडिकेटेड सोप और एनी नॉर्मल सोप इज इनफ, गुड इनफ?
See, our purpose will get solved by any ordinary soap.
All right, okay.
Okay. Then further is anybody's choice. You can go for anything. But अपना purpose एक साधारण साबुन से solve हो जाता है.
ओके। All right. Dr. Alka, एक और important question. Again, I really want to, ask you, why is, practicing social distancing very important? कितना important क्यों है आज के टाइम को लेकर?
See, the most important reason why we have to maintain this social distancing is because 80% of the cases who are infected don't show any symptoms. They are asymptomatic or they show very mild symptoms. So you're not aware who is carrying the infection.
Correct.
But they act as carriers. और जो vulnerable class को अगर touch करते हैं, जैसे कि छोटे बच्चे below 2 years या elderly above 60 years or any person who is already having a medical condition which is a vulnerable category, तो उनको बहुत easily transmit हो जाता है. Only because the symptoms are not very clear even in a carrier.
Correct.
Which is 80% of the cases. We have to just stay away from everybody.
All right. COVID-19 पेशेंट्स की अगर मैं बात करूं तो उनके लिए कितना ज़रूरी है न्यूट्रिशनल मैनेजमेंट?
See, nutrition management of COVID-19 patients is a very important factor in reducing the mortality rate of these patients. The reason being these patients are very prone to malnutrition because of various reasons. Like energy consumption बढ़ जाता है high fever की वजह से, breathing muscles are working more, artificial ventilation रहता है, because of which उनका energy consumption बहुत हो जाता है but intake कम रहता है. They don't have proper intake of nutrients because of many reasons, because of loss of appetite, because there's a ventilator attached so they cannot intake much things.
True.
तो ये जो difference है energy balance का, इसकी वजह से malnutrition बहुत easily हो जाता है. And if this malnutrition is not taken care of, it contributes to the mortality rate.
Correct.
So management of nutrition is a key factor in the recovery of these patients.
All right. So point noted, and I think boss को आपसे एक सवाल
yes,
करेंगे.
Our final question is, what is your message to all our listeners?
So before I give a message to the listeners, I'd like to thank both of you.
Thank you.
Our pleasure.
You guys are doing a great job, by entertaining people, keeping them mentally healthy, and also
Yeah, I think
providing
that's
them with
important.
information
Thank you so
by
much.
inviting all the experts.
Thank you so much, Dr. Alka. Yes, your golden words to our dear listeners.
So the message which I'd like to give to our listeners is that practice all the guidelines which are given by the government time and again, but keep away from any type of fear, insecurity, and non-acceptance. Like, we have to accept this fact that for our own good we have to maintain this social distancing.
Great.
It is not actually social distancing, it is physical distancing. We all are socially connected.
Socially
I'm talking
connected.
to you.
Good. That
Yeah,
was
exactly.
a good term. Good.
So we have to maintain this physical
Yes.
distancing for our own good and accept the fact. The moment you accept it, it becomes easy.
Yeah.
It's just a small time, will just fly off.
All
So
right.
because fear, insecurity, non-acceptance, all these lead to suppressed immunity.
Great.
Right.
So उसी नोट पर आई थिंक मैं आपको थैंक यू कहूंगी और आपने अपना प्रेशियस टाइम हमें दिया उसके लिए थैंक यू सो मच.
Thank you very much for joining us.
Have a
Thank you.
great
Thank you.
day and enjoy the show. Bye bye.
And have a lovely weekend too. Bye-bye.